Doctors are sounding the alarm over a silent crisis sweeping across America. A sudden rise in heart attack deaths, especially among people at home. Since the pandemic, cardiac deaths have spiked, even as hospitals report fewer admissions. Researchers say COVID may play a role, but lifestyle changes, missed checkups, and delayed medical care are also contributing. Today, we're breaking it down with Dr. Fahmi Farah, a cardiologist. Good morning. How are you?
Good morning. I'm doing well.
Yeah. Let's talk a little bit about what the research is showing us. What do we know about heart attack deaths since 2020?
Well, the recent data suggests the heart attack rate has gone up pretty significantly since 2020.
I think I read that it was roughly almost 20%, up 17%, with many of the deaths occurring at home. They talk about how life has changed and since COVID and lifestyle changes, missed checkups. I think that's a real thing. Do you feel like people after COVID, we couldn't go places during COVID, and I think we stopped going a lot of places, and I think one of those places may be the doctor's office.
You're right. I do think that statistics of, as you mentioned, 17% increase in heart attack rate, it's due to more than one reason. A large portion of it, of course, due to the virus itself damaging the cardiovascular system. But yes, the lifestyle change, I think that's contributing majorly. As you remember, during COVID, people were remaining home, they were working from home, they weren't really going out much, so they developed a more sedentary lifestyle across the board. And I think that is contributing to some of these statistics. And I do agree that less people are inclined to go to their doctors in a timely manner and seek help, and that's part of the reason we're seeing some of the changes as well.
You talk about the virus. What does the virus, or what did the virus do to our hearts?
Well, the studies recently are showing that the virus has the ability to damage the cardiovascular system. It weakens the vascular system, and it does have the capability to increase risk of heart disease, especially heart attack.
Is that something that if I go in for a checkup, they'll be able to see, that my vascular system is weaker or potentially in danger? Is there something we can do about that?
Yes, there's a lot to be done. If all you need to do is just have a simple checkup by a cardiologist. There are several modalities of testing we can do to assess your cardiovascular health.
It seems like almost anyone who's had COVID probably should get some sort of test, just a checkup to get a baseline to see where they're at.
I do agree with that, especially based on the statistics that are coming up. A lot of the guidelines are still based off of the old, old data, not necessarily changed based on the new data. So I'm interested to see what the new guidelines will be suggesting, but I couldn't agree more that it's better to get a checkup and be on the safe side.
Why do you think the cardiac deaths are happening at home rather than in hospitals?
Well, at home, if somebody's having a heart attack in a hospital setting, there's a lot we can do. The thing with heart attack is time. It's a very time-sensitive thing. So if it's caught at a hospital or somebody is seeking help during heart attack and going to the hospital, they have a much higher chance of survival because there's just so much we can do in a timely manner, as opposed to somebody who's sustaining a heart attack at home and are not able to seek that help. Their chances of survival is less.
So it's probably important to understand the signs of a heart attack so that you do, call 911 immediately. What are some of the things we should be looking for?
In a classic heart attack symptom would be chest pain, shortness of breath, profuse sweating. All of those are pretty classic. People usually can tell, okay, I'm having a heart attack. The other ones are the atypical symptoms, and that's when people get into trouble. Atypical symptoms meaning they will not have the classic textbook symptoms of chest pain. They may not have chest pain at all. Sometimes they might have more GI symptoms like nausea. And so if somebody's having one of those atypical signs and symptoms, it is equally important to seek help and go see a doctor.
How do you know if you're feeling nausea or sick that it's something as serious as a heart attack?
Usually, if people are having a massive heart attack without chest pain, they will have pretty intense nausea. They may have vomiting with it, but they will also have profuse sweating and shortness of breath. They have this sense of impending doom that's pretty classic of like, okay, it's more than just a GI thing. But then again, there is a subclass, women particularly, they fall under this category where they may not even have that. I've had women who haven't had any symptoms other than just fatigue. They've just had more fatigue than their norm, and they were having a heart attack. Sometimes they may have back pain or neck pain. So really, any symptoms that's other than your norm, you shouldn't ignore those. You should get those checked by a doctor.
What do we know about younger Americans and cardiac problems since COVID?
It is up. There was a study that was done showed that in the younger population, particularly the age group 25 to 41, this is primarily an age group that we didn't think to have cardiovascular disease in the past, but that has changed. We've seen a pretty high increase in heart attack and heart disease rate in that population. So yes, we are seeing an increase in the younger population with heart disease and heart attack.
How do you think we're doing with our lifestyle factors? Did they get better or worse as a result of the pandemic? On one hand, some people got out and, to get out of the house, they walked or they did different things. On the other hand, we were stuck at home, so a lot of people watched a lot of Netflix.
I think majority fell under that latter group. People just started staying at home. They weren't really able to go to the gym. And so as a result, I think majority fell under the category of adopting a more sedentary lifestyle and letting go of their healthy habits. And I do think that we're seeing the reflection of that now in some of the statistics that we're seeing today.
Yeah. What are some of the things people can do proactively to reduce the risk of heart attacks?
80% of heart disease is preventable by very simple things that are actually in our control. And it comes down to lifestyle, which is eating healthy and exercising. So more vegetables, less red meat. Your healthy diet goes a long way when it comes to prevention of a heart attack and heart disease. Same thing with stress management. Very important that you take care of yourself and, having close support system. So all of those help in reducing the heart attack risk factors.
Yeah, it's hard to believe that the pandemic was 5 years ago, but I think there's a lot of people who haven't been to the doctor for a regular checkup since the pandemic. For people who've kind of just got away and stayed away, what is your message for them?
Your health is your biggest asset, and when it comes to your heart health, it's the most important part, just because it's the only one you've got. If your heart is not good, then obviously it has a tremendous impact on your life expectancy as well as quality of life. So I really encourage everybody to get out there, start exercising, eat healthy, and just take care of yourself for a better and more fulfilling life.
Dr. Fahmi Farah, cardiologist, thank you so much for your expertise. Thanks for spending some time with us.
Thank you for having me.